Certainly.
What is the fiscal impact of this? Is there a fiscal component? Like, why is it in the budget to begin with?
Because the budget, they had a separate bill, doing the same thing, but they couldn't get it out of committee. And so they put it in the budget because they realized they had more leverage with it in the budget. They were hopeful that people would vote for the budget, even with that bad language in there, thereby enacting the law.
So this isn't
the fiscal impact to the Commonwealth, although they don't speak of it in their proposal, is not insignificant from the very start. As I'm sure you're aware, the Affordable Care Act, Obamacare, commits to pay for the first 3 years 100% of the cost of expanding Medicaid to 138% poverty level, which in Virginia could pick up as many as 400,000 new people. What it doesn't consider, and Stafford County should be very concerned about this, are the ancillary costs. If 400,000 people enroll in the expanded Medicaid across Virginia, how many will live in Stafford County? And then you have to figure out how many more DSS workers are you going to have to hire to handle this new population. And that's something that you all pay for. I think the state helps you with that. But the federal government doesn't pay for that. 400,000 new people across the state. They tell me at Department of Social Services, the rough rule of thumb is for every 1,000 Medicaid clients, you need to have another worker. 400 new workers across the state times, I don't know what they get, but when you add in their benefits and everything, you're probably looking at a fair amount of money year after year after year. The bigger concern I have is in the out years when the Act says that the 100% of Medicaid reimbursement goes down to 90% by 2022, I think. And then the federal government will pay 90% of the cost forever. Well, even if you think they can do that, and I'm very skeptical, 10% of that cost would be about another $250 million a year for Virginia to pick up. And if you add to that the couple $100 million that we're going to have in administrative expenses and the inflation on the existing Medicaid covering 900 and some thousand people across Virginia, which is growing at 8% a year. Right now, in this fiscal year, we're spending about $4.1 billion on Medicaid. That's the largest item in our budget, more than public education, more than anything else, and the fastest growing. Over the last 10 years, it's been growing at about 8% a year. That means it's going to double every 9 years. In 4 or 5 years, at 8%, that $4.1 billion will probably be closer to $5 billion. And you add to that the $500 million that's going to come along from administrative expenses plus our 10%. And that's best case scenario. Worst case scenario is the federal government walks away from that 90% commitment because they can't do it. They're broke. They're $17.3 trillion in debt today. And they're adding to that debt about $500 billion to $1 trillion a year. They're going to have to cut. And if they walk away from it and say, okay, we're only going to pay 50% like we pay for the rest of Medicaid, that's another $1 billion a year that Virginia has to pick up.
Have you seen the analysis of what happens to the federal mandatory spending in 2025 and how that ramps? I don't know how they'll pick up anything after 2025. In fact, we'll be lucky if we're nothing but a government that passes money from one to another. But
I apologize. I wasn't going to talk about Medicaid expansion. I think the important thing that Stafford County can help with right now is a resolution to say that whether you're for Medicaid expansion or opposed to it, it shouldn't be in the budget as a line item amendment. Take it out of the budget, give us a clean budget, and we'll have you a budget in a week.
Mr. Mode?
And I know you just said you don't really want to talk about it, but I feel I want to mention a few things that anyone that's dealt with a budget here in Stafford before knows that we're already faced with this phenomena where social services is a perfect example, but the court systems are another, where when they grow, the sponsoring organization simply doesn't pick up the full cost. And it's a problem right now. Social services is understaffed, and they're doing more because of federal mandates, and we're not. We're trying to figure out how to just manage what they've done so far. On the other point, and I don't know if I saw some changes in the notes on the budget, but last time I asked last week, it was about $500,000 overall that the Affordable Care Act is costing the Stafford County government, about $500,000. Is that still about the same, Anthony?
Yes, sir.
And I know that's not exactly it's very much related to what we're talking about. So When we're ready, I'm happy to make this motion.
Mr.
Yeah.
Thomas,
Before you second that motion, I think we need a motion first to waive the bylaws.
that is correct.
Move to waive the bylaws for this
Second.
purpose.
Second.
Cast your vote. Tally the vote. Motion passes 7-0 to waive the bylaws. And now Mr. Snelling's.
Just real quick to underscore the speaker's statement, social services would be required. Our social services would have to hire about 5 to 6 people to cover this. But keep in mind, we've gotten a little off course here. This is not about whether we're in favor or not in favor. This is about getting that budget passed and passed quickly, because if this budget doesn't pass, we're all going to be in serious trouble, whether in favor of this or not. So I think it's very important.
And I think that Virginians in particular have felt the brunt of the federal shutdown year in and year out. And I don't think that we want that from the state government. I believe that the message is clearly received out there. And so decoupling the Medicaid issue from the budget, I think, is a prudent measure.
What we've just discussed, especially what Gary said, is exactly encompassed in this resolution, and it's lengthy, so I will move Resolution R14-75 unless somebody would like for me to read it.
Okay. Any other comments? Cast your votes. Tally the vote. The motion passes 7-0.
Thank you all very much.
Thank you, Bill.
Appreciate it. I'll try and get you a budget as soon as I can.
Thanks. Next, excuse me. Next up.